Hello, everyone. Welcome to this professional roundtable regarding health fields. So today we have two important guests for this specific session that we are hosting today. Just a reminder that you are muted and your video is turned off as well as your microphone. But if you want to ask some questions, we have the chat box function, so you can send your questions to one of my peers. I don't know who, Ana del Arenal will be gathering collecting your questions, and then at the end, this will be passed on to to our panelists. Okay, so remember that for this session, we have also able the English closed captioning. So in case that you are unable to listen us, well, you can read us. Okay, so next slide, please. So yeah, as I said, today's professional roundtable is regarding health fields. And for that, we're gonna discuss with our panelists in a panel manner. But before that, next, please. What is Education USA? Maybe this is your first webinar with us, Education USA. Maybe this is your third or your fifth webinar with us. But I just want to make a little bit of introduction regarding who we are and what we do. Okay, so we are a global network of advising centers. We cover almost the whole world. Here in Mexico, we have 26 centers. But if you are watching us from another part of the world, you can find your nearest advising center, and we can provide you with free services regarding one-on-one advising, webinars, workshops, and other several activities that we have prepared for international students. And remember that these services are for free, so you just have to look for us. Okay, next one, please. Okay, before we start this specific roundtable, we know it is a very interesting topic for several of you. Okay, we just want to make clear on some specifics regarding this session today. Okay, so many of you maybe are here because you want to study medicine in the United States. Okay, and here are just a few steps that you have to consider before start planning your medicine career in the States, okay? So for the first point, so these are only recommendations for those that would like to pursue an education on medicine, okay? So first, you have to obtain a bachelor's degree. Where do you have to obtain it? We recommend that you obtain this specific education within your home country. Why? Because studying medicine in the States, it is complicated, yes. It is expensive, yes. And in a way, it needs to be a lot of planning. So for this, and a medicine program doesn't get studied in an undergraduate level, as let's say here in Mexico, for example, okay? So medicine, it only gets studied in a graduate academic program, okay? So for that, you first have to obtain your bachelor's degree, preferably in your home country, okay? So medical school admissions boards require all applicants to earn bachelor's degree from accredited colleges and universities. This can be done, as I said, in your home country, or look for these options, okay? The second step, pass the MCAT, okay? College juniors interested in a career as doctor should register for and take the medical college admission test, which is the MCAT, okay? This test is a standardized multiple choice examination used by medical school admissions committees to assess a candidate's likelihood to succeeding in their program, okay? So maybe you are thinking, okay, but I would like, as soon as I finish my high school, I would like to be a doctor in the States. Okay, so here are the specific steps for this, okay? So step number 3, apply to med school. As I said, you first have to complete your bachelor's education, preferably in your home country, and then apply to med school, considering these first 2 steps, okay? So step number 3, apply to med school. Most medical schools in the US use the American Medical College Application Service, which is a centralized application processing service from the Association of American Medical Colleges. Here, the students select their target medical schools and submit a single application to this specific service, okay? This specific service will distribute all your applications to the institutions that you selected already, okay? Number 4, pass the United States medical licensing examination. In order to practice medicine legally in the US, students must take and receive passing a score on this specific test. A 3-part examination taken during and after medical school. Medical students must pass the first part of the examination. During their 4th year, students must pass the second part of the exam. So this is an exam divided into 2 parts, okay? Step number 5, match with a residency program. During their final year of medical school, students start narrowing down their medical specialty options. Example, pediatrics, anesthesiology, etc., etc. They submit an application for residency and are matched to open residency programs throughout the country. Number 6, graduate and start your residency program. Newly minted doctors transition from graduate school residency programs. These programs generally require at least 3 years to complete and provide in-depth training in students' chosen specialties. And number 7, the final step of the residency process is to complete the part 3 of the United States medical licensing examination. This examination will cover clinical management and assess the doctor's ability to practice medicine safely and effectively. And finally, you have to complete your residency. As I mentioned, today we are going to talk about several other health fields that maybe you aren't aware of yet. And I don't know if we can pass on to the next slide, please. Okay, so here are some pathways in health fields, okay? Because studying a career in health fields doesn't necessarily mean that you are going to become a doctor, okay? So this is just an example of some pathways within health fields that you can achieve and that you can pursue, and maybe that you aren't aware of, and you still have to prepare for this. But again, this specific roundtable session will be to open up your horizons and your perspective regarding health fields, okay? And remember that this session is a professional roundtable focused on these specific health fields. If you would like to learn more about the admission process to medicine and other health programs, we have resources and sessions on our YouTube channel, and you can also contact your local education advising center. Okay, so without further ado, I would like to introduce my peers, Jenny Diaz and Luisa Caballero. They will be moderating this interview with our panelists. Thank you very much.
Thank you so much, George. We're very happy to be here today. Thank you for this opportunity, and thank you all for joining. Before we go ahead and start our amazing guest speakers today, I would like to know, and we all would like to know, where are you connecting from? Could you please type on the chat what country, state are you joining from today? So we have an idea of where our audience is coming from. Yeah, I guess you can chat. And if you can start sharing your answers. We know this is an event that is going through Mexico and North America, the Caribbean. Okay, we have someone from Hidalgo. Hidalgo, Canada, Mexico, Guadalajara, Jalisco in Mexico, Guadalajara twice, and Yucatan. All right. We have people from San Luis Potosí, from Quintana Roo. So thank you everybody for being here. There are a lot of people from Mexico. As you can see, we also have people from other countries like Canada. Here's one from Honduras, another from Canada, Trinidad and Tobago. So thank you so much, everyone who is joining today. We have a pretty diverse audience. So And my next question for you all would be, before we start, why are you connecting today to this session? What would you like to learn? Why did you decide you want to know more information about health fields in the United States? That's one answer. And then we got another that I would like to know more about what it means to be a graduate student in health fields. All right. I would like to know if there are any scholarships for international students. Okay, good. So if you have any more comments, you can type them on the chat and we'll make sure to read them to our panelists. So I'm gonna go ahead and start introducing our guest speakers today. And we have Dr. Roberto Rivera Luna. He is a pediatric hematologist, oncologist, researcher at the oncology department from the National Institute of Pediatrics, residency in pediatrics at Baylor College of Medicine, pediatric fellowship at the University of Texas MD Anderson Cancer Center in pediatric hematology and oncology, Master of Science at the University of Texas at Houston, researcher in medical sciences at the National Institute of Health at Mexico City, researcher of the National System of Research, SNI CONACYT for the past 35 years, currently level 3. He's also a member of the Mexican Academy of Pediatrics, National Academy of Medicine, and 5 other international medical societies. Currently, there are 197 publications of the specialty in national and mostly international medical journals, 21 book chapters of the specialty, and 13 books as an author on this topic. He's also a professor of the postgraduate course in pediatric oncology, UNAM, for 39 years. During this time, 124 graduate pediatric oncology residents have graduated and 16 graduate students of Master of Science at the UNAM, Direction of Thesis of Residence in Pediatric Oncology, Master in Sciences, and co-director in doctoral thesis in 39 students. He is also the director of the Pediatric Oncology Program at the ABC Medical Center. Last but not least, from 2005 to 2018, he worked as national coordinator in developing the treatment protocols for childhood cancer from the Secretary of Health. Since June 2022, he has post of permanent advisor to the Council of General Health from the Republic of Mexico to advance the treatment protocols for childhood cancer. Thank you so much, Dr. Rivera, for accepting this invitation and for being here with us today.
Thank you, Ms. Diaz.
Sure. I would like to give the floor to Luisa.
Thank you very much, Jenny, and everyone for being here. I'm going to present our next guest speaker, which he is Jorge Buendia. He has a Bachelor of Genomic Sciences from UNAM, a Master of Philosophy in Biological Science from Cambridge University, also a master's degree in Computational Biology and Quantitative Genetics from Harvard University. Jorge was born in Mexico. He studied his bachelor's degree at UNAM, where he did research on genomic cancer at the Wellcome Trust Sanger Institute. While studying his first master's degree at Cambridge University, he focused his studies in understanding the shape of the brain during the embryonic development. During his second master at Harvard University, he developed a computational model for a better understanding of breast cancer. He is currently doing research at the Broad Institute at MIT in Harvard in breast cancer genomics. His scientific interests are the intersection of medicine, mathematics, and computer. Another interest of his is science education, which has been a driving force in him becoming an instructor and part of the organizing team of clubs in Ciencia Mexico, and he began this role in 2014. So thank you very much, Jorge, for being here.
Thanks for inviting me, everyone.
So we are going to go ahead and start with our questions for you. And I would like to start with you, Jorge. Our first question would be, so as we heard before, you are currently doing research on breast cancer genomics. How has been your journey to get there? We would like to hear a little bit more about your experience and your academic background.
Yeah, so I do breast cancer genomics, or I used to do breast cancer genomics until a few months ago at the Broad Institute, which is a research institution part of MIT and Harvard. I recently transitioned to a new job at a biomedical or biotechnology startup, also here in Cambridge and Boston. But yet I spent 4.5 years doing research on breast cancer genomics. And the question, like, how did I get there? Well, academically, as you said, I started my career in the genomic science program at the National University of Mexico, UNAM. And during my undergrad, I did a couple of projects in cancer, not necessarily breast cancer, but melanoma, which is skin cancer, and also some types of glioblastomas, which are tumors in the brain. So after my second master's here at the University of Harvard University, my thesis was actually focused on computational models of how a breast cancer tumor evolves and how it grows inside a patient. So from that computational modeling, which was a lot like very similar to kind of creating a video game in which, every cell in the tumor was a player in the video game, and every player in the tumor or every cell in the tumor wants to grow and wants to divide. That's basically what a tumor does. Dr. Roberto will probably talk a lot about tumors maybe, and he's also an expert in that field. So basically the tumor wants to grow and wants to reproduce, and the cells want to just keep reproducing without control. So in a way it was like fun because it was just computationally and mathematically, how can we model that tumor growth? And then when I finished my master's, started working at the Broad Institute as a computational biologist. And the lab I was working in, we were focusing on the evolution of a tumor, a breast cancer tumor. And the reason why we were interested in the evolution of a tumor is because patients normally respond to treatments for a few months, and the tumor starts getting smaller or shrinking. But then after a few months of treatment, patients stop responding to treatment. And that's because the tumor is evolving, right? Like genetically, the tumor is changing. So there are new mutations inside the tumor that cause what we call as treatment resistance. So basically the treatments that we have are no longer effective because the tumor now has evolved mechanisms of resistance to those treatments. It's like an arms race that, like the tumor wants to evade treatment and finds ways around the treatments that we are giving the patients. So that's how I got to breast cancer genomics.
Thank you so much, Jorge. I'm sure that's a lot more complicated than what you are trying to explain today, but we really appreciate you explaining in the audience that in a way that we all can follow you, right? So,
sure. And if there are questions, like if I say something that is not clear, of course, just type in the chat if you have any question about what I'm trying to say or explain.
Thank you so much, Jorge. And now we're going to continue with Dr. Roberto Rivera. Sorry, before I go ahead with Dr. Rivera, just as a reminder, if you have questions, as Jorge mentioned, you can refer them to Q&A and del Arenal in our chat. So now, Dr. Rivera, could you explain to our audience what a pediatric hematologist oncologist is? And how would you describe the journey to get there as well? Tell us about your experience and your academic background.
Well, it's rather complex. As you can see, I'm not a teenager nor a 30-year-old man. The real thing is that it's 1968, that was way before you were born, all of you. There was a political movement in Mexico in which the history shows that there was a lot of political insurrection from the medical students and students from the National University of Mexico and the Polytechnic Institute. So the only alternative we had in those days, in 1968, I was just finishing medical school, was to move to another country because they were sort of trapping all medical students or students from the National University of Mexico. And there was a lot of political oppression. There was no way of expressing yourself or complaining yourself about the need to have some residency programs which were totally absent. Or if there were, for instance, in the IMSS, Instituto Mexicano Seguro Social, well, there was no pay. So the only favor that the IMSS used to give to those future residents was to join the hospital but without any pay. So that was a terrible situation. I shouldn't go any farther with this point. So I moved to the States. I went to University of Miami at Jackson Memorial Hospital for a training program in order to pass what is currently known as the USMLE. In those days, it was called the ECFMG. It was a type of examination designed to be done by all the medical students as a postgraduate training. It was a rather wide open examination. And after receiving that course for 4 months, everything was fine. I passed the national boards, as we used to call it. So eventually I went into University of Texas at San Antonio. No question, I'm a Mexican. So I say, well, the closest place to Mexico, I don't know if they're gonna, suddenly I'm gonna disappear from the hospital, because I was feeling not very comfortable with the whole situation. Not everybody was passing that exam. Approximately only 16 to 20% of those Mexicans and foreign students that presented the examination passed. So I was one of the fortunate to pass. So I went into a straight pediatric internship. Then I moved to Baylor College of Medicine in Houston, and I did a pediatric residency at Texas Children's Hospital. Then I moved to MD Anderson Hospital just across the street at the Texas Medical Center. And I discovered, while I was a resident in pediatrics at Baylor, that childhood cancer was a big problem in the United States. And also, obviously, it was a tremendous big problem in Mexico. Most of the children that had cancer in those days in Mexico died. A mortality rate of 82%. It is documented. I'm not coming out without those figures. So I decided to just go ahead and go into cancer, childhood cancer. Childhood cancer training took 3 years, 3 years of fellowship. Once I finished my residency in pediatrics, I joined MD Anderson Hospital, MD Anderson Cancer Center, which it's part of the University of Texas. And in that same place, I decided to get into a bachelor's degree in science and start looking upon all the problems that I could eventually do in Mexico. While I was in that fellowship program, I came as a visitor for a couple of weeks to Mexico City, and I visit Hospital Infantil de México and Seguro Social Hospital de Pediatría. And those were the only 2 institutions that take care of children with cancer. And I compared those services with MD Anderson Cancer Center. There was no question that they didn't do anything, because there were no facilities, there was no financing programs for residency program. Everything was very minimal. So after finishing my fellowship and my master degree, after 3 years, I moved to Mexico City and it's like climbing to the Everest, Mount Everest, you know. It was sort of hard work. Sometimes I'm not trying to crucify myself, but it was something like starting working at 7 o'clock in the morning at Hospital Infantil, and I finished in some other clinic, which I was taking care also about patients, sometime around 11 or 12 o'clock at night. In those days, there were no pediatric oncologists, just one person that was working in Hospital Infantil and another person at Oncología at the Hospital de Pediatría in IMSS Medical Center. So you can imagine the amount of patients that we can hardly take care of. Most of the patients that had cancer in the out of Mexico City were taken care of in Guadalajara. In Guadalajara in those days, the only one who took care of patients, children with cancer, was a pathologist. And then he became an adult oncologist. But adult oncology and pediatric oncology are two things completely separate. So, but in any event, he was working hard as well as the rest of the people. In Monterrey, there was another person that was taking care. He was a hematologist, an adult hematologist, but he was also taking care of solid tumors in children, as well as hematology in children. So that was the whole picture in Mexico in those days. So that was a terrible situation in 1978. So suddenly I was offered to move to the Hospital Iman, which was a brand new hospital with new equipment, with no financial limitations. It is it is a federal institution. So it was really a very special place, which is still up to the present time. A very special place because we have a full tower of research in pediatric oncology, basic and translational research. We have a full hospital as well, a second building for the clinical management of all the oncology patients that we have. We see patients between age 0 to 18 years. And going now in a general way, currently childhood cancer is the second cause of death among children between 4 and 15 years. Only second to accidents in childhood. And this is very, very severe. It's a very dark situation. So the problem currently is that it appears that we have more cancer in a proportional way than USA. And this is due to a lot of factors that are influencing from the epidemiology point of view. 50% of the children with cancer in Mexico have acute leukemia. That's very important. We have published well-documented statistics from different official government official data, and 50% of just leukemias, it's a lot of leukemias. If we compare those statistics with the United States, we can see that there's a tremendous difference. First of all, in the United States, 40% of childhood cancer are precisely in those children that develop leukemia. But the important point is that Hispanics, as they determine with this type of term, Hispanics, children coming from Hispanic families are the most common children that develop acute leukemia, followed by, in a very important proportion, white children. So the difference, it's really very important. Several institutions back in the States, we have worked and still working with several protocols. They question how come the race Mexican American or Latins, as they describe in some cases, they have more leukemias than white children. And this is like a mirror that goes to Mexico. The most common cause of cancer is leukemia in Mexican children. So probably there's a background which is very solid. And this goes to molecular biology, in which is the area which we're working currently. And it's related to some data that has been previously published, but in United States, but it's been reinforced by us in Mexico, denoting that it's the genome that can be altered in Mexican children. And it is something that is related to the race, not to the environment, not to the external factors that could influence this incidence of leukemia. Well, that's one part, and I wouldn't go any further. The second part is that because of this large problem, there are 59 hospitals in Mexico, all the way from the northern part of Mexico to the southern part, from Tijuana to Mérida, that take care of children with cancer, are the certified institutions. And these certified institutions currently I'm talking about the past 3 years, are facing tremendous problems, such as, for instance, limitations in the amount of money that is assigned to those institutions to take care of children with cancer. We're not talking about private patients. We're talking about those children that live under poverty. 55% of Mexicans live under the line of poverty in Mexico currently. That's 55 million Mexicans. And within those 55 millions, well, there's 17 or 20% that are children. So therefore, the situation makes it even more severe in regards to the outcome of these children. If they're going to a hospital that they don't have funds, they don't have sufficient nurses, they have limited laboratory studies, they don't have, they have some X-ray equipment that is very limited. They hardly have CAT scans on or MRI that helps to stage the patient. Well, everything is very limited. And in top of that, we have limitations of chemotherapy.
Dr. Roberto, I have a couple of questions from the audience who are asking regarding what you are sharing with all of us about, and I think Jorge, if you want to jump in also and help us answering those questions, is like all of these factors and everything that we all find in Mexico and in other countries, how they, as people who are interested in the health fields, can join and help. What would you recommend them if they are an interest in joining to these health fields? How can they help to improve the situation if they are interested in pursuing these fields?
Surely. Well, the important thing is that whoever goes to the United States for training, my real recommendation is that if you really feel that you like medicine fields, that you are interested in joining any type of medicine. No, I'm not talking about becoming a doctor. this goes beyond this topic we're having today, but there are more than 80 types of paramedical specialities in the could join. This includes nursing, radiology technicians, laboratory technicians, physical therapy technicians, that goes on and on. But there's another field that is needed desperately, and those are the ones that give us the hand in research. We need biologists, we need chemistry, we need those kind of specialties within the field of medicine, not being a physician, but being somebody that has a lab and can really work desperately and help to solve a lot of problems. So you have to be honest with yourself and see if you're going to any of those fields and become somebody that can change the health system of a country. For example,
Thank you so much, Dr. Rivera. I think that definitely is pretty important. Like, I think you mentioned perfectly that we need to start thinking and looking at other areas that you can improve or the situation. And I think Jorge is a great example of this, that he is working on research and doing all of that with these different institutions. So Jorge, could you please share with us what recommendation would you give to these students who are here today listening to you both, who want to start in any of these areas that Dr. Roberto already mentioned, or in the area that you are working? What would you recommend to those candidates who are planning to start joining a journey like this one?
Yeah, sure. So I think I agree 100% with what Dr. Roberto said. There are so many areas in healthcare, right? Like, of course, medical doctors or physicians are one of those career options, but there are also like many others, nursing students or nurses, people who actually take care of patients, like social workers, but then behind patient care, you know, like the front line of patient care, there is a lot of things that have to be done behind the scenes for a treatment or a medicine to be available for patients. And that is all based on research and science. So what I do is trying to discover new medicine and trying to discover new treatments for different diseases. So the first thing I would say is like, if you want to follow a career in healthcare, either as a doctor, as a medical doctor, or as a scientist, or as a researcher, you have to kind of like know yourself, and you have to ask yourself the question, do I want to be treating patients, or do I want to be doing kind of like more behind the scenes work that is also like very important? So that's a very difficult question to answer, right? And that depends a lot on what you like, your personality, what are your you know, the things that you are good at. Maybe you are very good at maths, maybe you are very good at you know, computational stuff, maybe you are very good at chemistry, or maybe you love working and seeing people all the time and talking to people, then maybe you should be a doctor. But if you know, if you still want to be in healthcare, but you feel like you are not made to deal with patients, then there are so many options for you. So I guess asking yourself what you want to do, like if you want to be a doctor, as Jorge was saying at the beginning, for people who live in Mexico, medicine is like you study medicine right after high school, so it's an undergraduate degree. In the US, if you want to have a career in medicine in the US, you have to first do a bachelor's degree in another field, like could be biology. A lot of people do biology. A lot of universities have pre-medical programs, so those are actually tailor made for people who want to follow medical school after finishing their undergrad. or physics or math or some type of science, and then you have to apply to medical school, which is as Jorge was saying, taking the MCAT or the admission exam to medical schools, make applications, etc. But also you can come to the US after you are already a doctor in your home country, in Mexico, for example. If you go to medical school at UNAM, I have actually a lot of friends who have come from Mexico after studying medicine at UNAM and then come here, take the steps or the USMLE exams. There are 3 exams, or what they call them here, step 1, step 2, and step 3. And those steps are basically what gets you into a residency program. You have to excel at those exams, and then you get into a residency program. Could be pediatrics, could be internal medicine, or any other specialty, surgery maybe. So just going back to the question, just ask yourself what you want to do, and then from there, kind of draw a path for yourself. And that path is unique to you, right? Like there is no general path that everyone has to follow. Draw a path that is tailored for you, for your needs, for where you are in your life. Maybe you're in high school, maybe you are already in an undergrad program, and maybe it makes more sense to finish your undergrad and then study a graduate program in the US or somewhere else if you want to do a career in a healthcare field. Yeah, that would be my suggestion. Just basically know yourself and decide what career you want to follow. And like that's another topic that we can spend like 2 hours with that. Just if you have any particular question, like how do I decide if I want to be a scientist or if I want to be a doctor, that's a big question that we can have another conversation about that.
Yes, for sure. Thank you very much, Jorge, for your answer to that question. I think you are really accurate because it's at the end of what you want to do, of what you want to pursue in your life. So I think that your answer it's really accurate. And I'm going to ask you also to you, Jorge, another question regarding this that you were saying. Like we heard on your bio, you have scientific interest at the intersection of medicine, mathematics, and computing. So please, can you share with us some collaborations you have done with other professionals in this area, or how are you like making this happen?
Yeah, sure. So yeah, when I was in high school, I thought I was going to go to medical school in Mexico. So that was kind of my plan. But on the side, I loved maths and computer science and science like chemistry and biology. So that's when I decided to study genomic science instead, because it was a more integrative program that combined maths, computer science, and also a lot of biology, genetics, physiology, etc. And I think it was the best choice for me. And how I combine all of those interests right now in my career. When I was before working this company where I work now, I used to work at the Broad Institute, which is, as I said, a collaboration between MIT and Harvard, and also a lot of the hospitals in the Boston area. So if we want to study breast cancer, we need samples from patients, and how you get patients to be enrolled in your studies, you have to talk to the patients through their doctors. Like the physicians actually have to be in the hospital with the patients. You come as a researcher, talk to the patients as well, and kind of like get them involved in your research. So that's how I interact with physicians or doctors. I interact with biologists and chemists all the time these days, because if we want to develop a new medicine, a new molecule, chemists know everything about molecules. So I know computational biology, which is how to write code and how to analyze data from many samples and sequence genomes, etc. But in the end, if we find a gene or a molecular pathway in the cells that can be targeted, we have to go talk to the chemistry people, because they actually know how to design a molecule that will make the cells change the behavior in the way that we need them to change the behavior. I talk to biologists all the time because they know how to design experiments in mice or maybe monkeys or maybe cell lines to understand the disease that we are working on. I interact with mathematicians because they know how to develop mathematical models of how, for example, what I was telling you guys before, how a breast cancer tumor evolves and how to dissect the biology into equations, and then how those equations can help us understand the behavior of a biological system. So that's how all these different disciplines and sciences come together to understand biology, and in the end to create better treatments and better opportunities for patients, but also for doctors that treat patients. If a doctor like Dr. Roberto doesn't have treatments, then there is not a lot that they can do without medicines, right? So yeah, that's how all these fields come together to improve healthcare.
Yes, sure. And I think that all together make like the ultimate goal. So that your answer lead us to our next question for you, Dr. Roberto, which is, with your experience working in health fields with a lot of researchers in Mexico and in different countries, can you share also collaborations, or how does your collaboration have helped you to make your work successful?
There's no question that Mexico is a middle-income country, and I'm afraid that it's eventually going to become a low-income country if the current situation remains. I shouldn't say just in Mexico, but in a global way. Inflation is getting worse every day. Therefore, medications are getting more expensive. The infrastructure of the research laboratories we have are becoming every day by day, more difficult to obtain grants, national grants, and therefore we have to apply for international collaboration. It has come from several countries. One of the, for instance, it's just an example, one of the strongest programs there is about bone marrow transplantation comes from Spain. No question that in the United States, there's a lot of strength in that type of treatment, especially for acute leukemias. But in order to really join those groups, we have to demonstrate the kind of medicine we do. And the only way to do it is through doing research on our own, publish the results, and try to conquer the market. I'm talking about market. I'm referring to different institutions worldwide that might be interested in joining. Since we have published the findings that acute leukemia, lymphoblastic leukemia is really prevalent among Mexicans, Mexican children, of course. There are a lot of hospitals that are back in the States or even in Europe. They're interested in working with us. So right now we're having some funds that we're reaching from, especially from United States, and some collaboration from a couple of universities. We used to have some sponsorship from NIH, National Institute of Health. But what we need is not only get the help or the assistance from international institutions. We need to create, as Jorge mentioned, biologists, chemists, based on research, so they can really get involved because sometimes it's like trying to raise roses in the desert. You know that cannot be possible. So you have to go straight to the point. And going back to the situation that was mentioned about health fields, to all those persons that are listening this presentation, I would invite them to recognize that if you get a scholarship from United States, you have a sort of a compromise to that. Once you have finished your training, it could be of any sort of training. I'm talking about getting a master's degree or or PhD in science, to return to your own country. Otherwise, we're gonna become a country dependent upon those developed countries. And that happens with Mexicans that have gone away to United States in different fields. I'm talking about health fields. For instance, the example is that we're deployed of qualified nurses, because once they move to the United States, they pass their exams, they probably stay 1 year for training, they immediately are hired by private institutions or even public institutions, medical institutions, and there's no comparison in regards to salary. And that makes it also with nutritionists, with psychologists, with technicians that even their knowledge is sort of limited, with all due respect. Technicians in the order of X-rays, for instance, they move to the States, or they move even to Canada to have better life. So those who are interested to going into United States for training, keep that in mind. This is a tremendous effort that you're doing, and Mexico is not going to remain the same forever. We hope that time will change things eventually, but we need well-prepared, well-educated, not only scientists, but technicians within the health system.
Thank you so much, Dr. Rivera. I think that's a great advice. And in the meeting of time, and because we're getting some questions from our audience, I'm gonna ask this question that I think is pretty interesting to both of you in a sentence, because we only have like 4 minutes left. In a sentence, what would you say is the most fulfilling aspect of your journey working in health fields?
Which is the most what? Sorry,
the most fulfilling aspect. Jorge,
you want to answer? I answer.
Yeah, the most fulfilling aspect of being in a healthcare field. I think for me that I don't work with patients, the most fulfilling aspect is eventually seeing the science that I do having an impact on the patients, or when we see an experiment working that takes us one step closer to having a treatment for patients. That's I would say that's the most fulfilling aspect of what I do.
Thank you, Jorge, definitely. And we all appreciate you for what you do, definitely. And then Dr. Roberto?
The most fulfilling part of my profession and my specialty is seeing a child being cured. We have patients that were treated 25 or 30 years ago that go and visit us at our hospital just for fun, just to show us that they have 2 or 3 children more, and that everybody, the family is healthy. That's a very fulfilling situation that I don't compare it with anything else. But we have to change the route. We should change the feeling that all children with cancer in Mexico deserve to be cured.
Thank you so much, Dr. Roberto. And with this, I just want to thank you both for this amazing discussion that we had today and for being pretty honest with us and with our audience. We enjoy being here and learning a little bit more about health fields today with professionals who are working on this area. So thank you for sharing all of this information. And before we finish, just share with you all our contact information. We are Education USA Mexico network, but today we know that we have people from all around different countries. So if you want to know more about Education USA or where your advising center is closest to you, you can visit educationusa.state.gov. If you have any further questions, please send them to mexico@educationusa.org. There is our Facebook, Twitter, Instagram, and just as today you had the opportunity to listen from these amazing professionals, we have more sessions with more guests and everything for you all to enjoy and join us. So thank you, Luisa, Jorge, and Ana for organizing this professional roundtable today. And Dr. Roberto and Jorge, have a nice day, and thank you for being here tonight.
Thank you for inviting us.
Thank you very much for all of you.
Good luck to all the students listening to us.
Thank you.